Some of the most serious and costly complications in intensive care settings are associated with inadequate blood flow, low oxygenation, and tissue damage, most of which are independent of diagnosis upon admission. For example, in the United States, there are over 5 million patients directed to intensive care each year. An additional 2.5 million do so in Europe and Japan. Unfortunately, more than 50% of these patients will develop single or multiple organ failure, and 10% to 29% will die while receiving critical care. On average, this situation costs at least $250 billion for the American and European healthcare systems combined, and tends to escalate substantially when patients advance into some form of organ failure or shock. But there is a possibility to reduce these costs by detecting this condition in early stages. The gastrointestinal mucosa has shown to be among the first tissues to highlight imminent and life-threatening complications, as it is extremely sensitive to the loss of blood flow. Florence, the mucosal injury surveillance system, is conceived for detecting alterations on the integrity of the mucosal tissue of the stomach. The device gathers relevant information from the tissue through electrical impedance spectroscopy and determines the magnitude of the reactance biomarker XL. The reactance biomarker reacts to changes in intracellular to extracellular volume ratio and cell membrane ion permeability, both of which are directly affected during hypoxia and ischemia. Florence consists of 3 elements: the Athena catheter, a bedside monitor, and a set of proprietary algorithms that compute the reactance biomarker. The Athena catheter is an enteral feeding tube provided with means for sensing electrical features of gastric tissue and means for sampling gastric contents and patient feeding. No complex training or changes in standard procedures are required, as feeding tubes are commonplace in intensive care units. The bedside monitor controls the Athena catheter, displays instantaneous and trend values of the reactance biomarker, and hosts the proprietary algorithms that process the signals sensed at the gastric wall. Current standard of care includes the calculation of scores like the Sequential Organ Failure Assessment Score and the Acute Physiological and Chronic Health Evaluation to assess the risk of organ failure. Despite widespread adoption, such scores are not entirely reliable, as they blend objective data with empirical observations and cannot be sampled continuously. Florence can benefit 7.5 million patients at risk of developing some form of shock. Considering that these patients stay in intensive care for 6 to 9 days and a catheter utilization rate of 3 units per patient, priced at US $200 each, the size of opportunity sums to $4.5 billion.